Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. Brad Heineck, physical therapist.
And I'm Paul Reiteman, physical therapist.
Absolutely. I'm exactly one half of the Bob and Brad physical therapy channel. Bob is here. He's actually back there. But we've got someone very interesting here. Paul is here to visit us and give us some excellent information about how to take care of knee pain at home, just like the title refers to. But before we got a giveaway thing, Paul.
Great.
And Paul's not familiar with the giveaway.
Nope.
So this is what we're doing here is we're giving away the wall anchor. Here is a sample of a wall anchor on a little model of the wall. And behind you have to have a wooden 2x4 and the screws you can see go into there. Look over here. Once you get them mounted on the wall, we get 4 of them in a set. And that's what we're giving away. You can use these for large loop bands. You can use them for these bands to do all kinds of exercises, whatever you'd like to do. So sign up. How does that go, Bob? Again, sign up in the... Oh, that's right. We're giving one internationally away because we've been getting comments. People from the UK and Australia, all over the world, they're disappointed that and it takes a little bit of finagling. So we got you this time. And also we're giving a set to United States people as well. So enough of that. Let's get on to the subject matter at hand. Before we go on, Paul and I, Paul, you're actually a doctor of physical therapy, right?
Yes, that is correct.
And you teach at a university.
I teach at University of Wisconsin La Crosse.
I went there.
Hey.
As a matter of fact, Paul was my clinical instructor 25 years ago.
Wow.
You look exactly the same, Paul.
I wish I did,
Me
Brad.
too.
I wish I did.
And plus, what else are you doing now?
So I also continue to practice physical therapy. I have a small clinic down in La Crosse, Wisconsin, and then also teach to physical therapists. So I teach people who are studying to become a physical therapist, and then also teach to current physical therapists different courses, continuing education courses on different topics.
Right. As a matter of fact, I took 2 courses, a neck and a back course from you, and they're both excellent.
Of course they were.
That's what I like.
You have to say that, don't you?
Confidence. You need to be confident. Okay, so and we talked about this, and Paul was you seemed pretty excited, and actually you started telling me about this treatment. This is perfect for our audience because knee pain that comes for any age, but if you like a runner or you go out and do some gardening, you haven't, from the springtime when you get sore knees from doing activity that you haven't done before or whatever. You explain it.
Right. So there's a lot of causes of knee pain. Obviously, the ones that involve trauma, where there's actual injury to the ligaments, to the meniscus, to the structures around the knee that require surgical intervention. This is not for you, okay? So this is, though, for people maybe who have had surgery, have scars around their knee now that are somewhat tight, cause some irritation when they do activity. This is for you, the post-surgery, okay? But also for the individuals who, let's say, want to start an exercise program, and they're starting to develop some irritation around the kneecap or in the front of the knee that is limiting their ability to carry out what they want to do in their exercises. This is perfect for you as a source to try, or as a method to try and alleviate some of that irritation around the knee so that you can work out a little bit better.
I'm going to show my knee. I'm not,
I'm
not being inappropriate, Paul. It's a family show. But so we're talking about maybe knee pain around the kneecap above.
Correct.
And these quadricep muscles.
Correct.
Could it be like if someone has an arthritic knee and they get some joint pain that radiates up?
Yes. So joint pain occurs a lot of times right where the 2 bones come together at the joint line. But then there's people who have arthritis, like you and I, who tend to be a little older. You can also develop a lot of tightness of the muscle in response to that arthritis. So even though they may have a little bit of discomfort here, a lot of people complain more about the discomfort above the kneecap. And that's a lot of times the muscle's reaction to the pain that they're having in the knee joint. So it's this chicken and egg. They start developing here, but then secondarily develop here. This sometimes goes away, but then they're left with a lot of the soreness of the muscle around the knee joint itself.
So what if the person was just having pain here? Could you still do this technique up here with hopes that the muscles are loosened up and it helps?
Absolutely.
Okay.
So the benefit of this technique is It does no harm to the structures around the joint or in the joint itself, whether it be the kneecap itself or the knee joint.
Mm-hmm.
And B, it is certainly worth a try for a lot of different patients who have this kind of non-traumatic knee pain, to see if by addressing the tightness around the knee helps to alleviate some of the pain that they have.
So the patients that you've worked with this, you'll show them how to do this and have them do it at home by themselves.
Correct.
Okay.
So I'll always kind of try it in the clinic first, see how they tolerate
Yep.
it, and then teach them how to do it on their own. And
Right.
the beauty of this technique is that you can use a lot of things that you can find in your home to carry out the techniques that we're going to show.
I think people are waiting to see the technique. So let's go on to
Yeah.
that point.
All right. Can I just mention too, you had mentioned earlier on, we didn't talk about it as much, but anyone who's a runner, who's maybe trying to increase their distance, anyone who's kind of a weekend warrior who, whether it's from gardening or biking or whatever, starts developing this kind of vague knee pain. Again, those people who do increased activity, that's who this is
Sure.
mostly
Okay.
for.
Good.
Okay.
All right. So I've got knee pain,
All
Paul.
right.
Let's see
So
what I can
let's
do to
give
take
this
care
a
of it.
shot here. So let me just go through a little bit of quick, really general anatomy. So you have the kneecap right here, and then you have the joint where the two bones come together. There's been a lot of interesting kind of studies that have looked at the irritability of the tissue. What tissues tend to become the most irritable in the presence of knee pain, and how do we decrease that irritability or that sensitivity? So the most common area is right in through here. We call it the retinaculum, where there's fibers of tissue that hold that kneecap in place, and those fibers become continuous with the muscle itself. So if you can address the fibers around the kneecap, but then also address the muscles above the kneecap, give it some, like Brad said, flexibility, but also help bring blood flow into the tissue, and that helps decrease some of the sensitivity, because all these structures are innervated by nerves, and if we can decrease the sensitivity of those nerves, that helps to alleviate some of the discomfort and pain that they have.
Sure.
Okay,
Can I go? Can I do it?
let's do it.
All right.
Let me show you first. Is that all right?
Yeah,
Or do
absolutely.
you want to do it?
No, well, whatever you think.
All right. So this is a special tool that you can purchase. We're going to show Brad, though, how to do it with a simple butter knife.
Oh,
at
good.
home.
I got lots of them.
Let's do this. This one's probably better.
Yep.
Okay. So you can use any sort of cream. So this is just a Palmer's cocoa butter formula that you can buy at any Walgreens or any drugstore, but you can also use any sort of lotion that works, and you just apply that liberally.
Just a little lubricant. For
Yes,
the
that's all it
tool.
is. It's not any magic potion at all. It's just enough to kind of create a lubricant for the tool as it goes across the tissue. Okay. So when you do this, you always start at the knee and work your way up. So for you, you're going to be pulling,
Okay.
not pushing.
Yep.
So you pull and you start on the outer part, work on the middle part, and then on the inner part. Okay. So for you, you're going to use two hands and you're going to hold it like such. So always start at the kneecap and work your way up.
Okay.
The second thing you have to remember is think about, we're in Wisconsin, right?
Yes.
Or Minnesota. You want to shovel, not rake.
Oh,
So
sure.
this is shoveling.
Yep.
This is raking.
So the
It's gonna-
angle.
the angle needs to be in a way where the instrument is angled away from you.
Mhm.
Okay.
Sure, I get it.
So you're going to use two hands, start there, and work
Do you
your
want
way.
me to go with a knife?
Yes. So let me just show. So there's traditional butter knives. So don't use the sharp side. Use the handle of the butter knife, and you're going to hold it like such, and then you're just going to go in those directions around the
Oh.
knee itself.
And
So
how
the-
hard do I push?
So that's the great question. It's whatever you feel like you can tolerate. So what you're looking for, though, is an increased tissue redness. So if you're not getting the redness, then you need to push a little bit
Oh,
harder.
Yeah, so I'm pushing fairly hard.
Okay.
And if I push too hard, it's a little uncomfortable. So
Yep.
I'm not going to go into that range.
No.
Oh, okay.
So let the symptoms be your guide as to how
Yep.
much you push.
Feels pretty good at first, and then it feels okay, and then
Yep.
I'm waiting for. Actually, it looks like on this side the redness is coming a little
Yeah.
faster than over on the other side. So we don't go up on the bone. We
Don't
stay,
go up on the bone at
Yep.
all, but you start kind of right where that bone is.
Yep.
There you go. Long, strokes
long.
work well,
So-
and you can work all the way up, kind of halfway up into
Sure.
the muscle itself.
This is kind of fun.
Yeah.
Actually, it's starting to
So-
feel good now. Can I try one of these tools?
You bet.
I just want to see, and we want to hold it this way, or could
Hold
you,
it either way.
Either way.
Yeah. So this is so if you hold it this way, you're going to have a smaller surface area.
Sure. Yeah.
If you hold it this way, you're going to have a much larger
Yeah.
surface area. So the smaller the surface area, the more aggressive it is.
Yeah.
The larger
Oh.
the surface
So
area.
you can do it whatever way feels
Yeah.
best, or what you feel.
Exactly. There's no magic to how the tool is held or any of that.
So typically, once a person starts doing this on this treatment, you may be here for 10 minutes, a half hour.
No more than about 3 to 4 minutes.
Well, you know me. A
I
little bit's
know.
good, a whole lot's better. But that's probably yeah.
So let the response of the tissue be your guide.
Okay.
So notice how you're getting all that redness.
Oh wow.
You're done. You're
That's
done
it.
there. Yep. But
okay.
so not much redness here. So
Yep.
you can work a little bit now there.
Could this cause a permanent, like a bruise?
So there's a possibility that this is always could cause a little bit of a bruise for about 24 to 48 hours.
Mhm.
That bruising is not bad. But what that does though is, you want to not do this again until that bruise starts going away.
So that is just some blood that has
That's a-
broken little baby vessels.
Yes.
Yeah.
Yep.
Okay. And
So there's actually some physiological rationale for that, but we won't get into it. But some clinicians actually like the bruise. They'll actually go
Sure.
to the bruise, but you don't have to do that yourself. But a good redness means that there's good blood flow into the area
Yeah.
now, and that helps to, again, improve the flexibility and the sensitivity,
Yeah.
decrease the sensitivity of the nerves.
This works a little better than a butter knife, but the
It
butter
does.
knife does okay. I
Yes.
mean, I wouldn't hesitate to use that.
So you,
I just wanted to mention, I remember when I took a class from you in the neck, and you did show doing this to a shoulder blade,
Yes.
and you mentioned once that someone did it to a patient, and it got the red and the bruise, but she was like in a wedding. And
yes,
she had a low cut dress, and it wasn't a good thing.
No, no.
So be careful of things like that if you
Right.
overdo it.
Be careful if they're a knee model. You don't want to do this if
Yeah.
they have a shoot for
Yeah.
the next day.
Yeah, I'm done because
Yeah,
it's
you're
red
done.
and it feels good though.
So notice how long that took. Probably we didn't time it, but 3-4 minutes or
Yeah.
so. But you were starting to increase the pressure
Mhm.
of the tool, I imagine,
Oh, yeah.
as you felt more comfortable with it. So what you're doing right now is a really good test.
Yep.
So identify something that caused some of your pain before you did it.
Like maybe
Do the
going up and down
technique,
steps.
Going up and down steps, running on the treadmill. So this is a great, again, if running is an issue for you, do it before you run and then go onto the treadmill and see if your pain decreases or
Right after you get
changes
done?
right after you get done.
So you got a benchmark.
You got
kind
a
of
benchmark
yep.
of where you start and then see how it responds after you do it. Okay.
Oh, wow, that's kind of fun. Okay, Bob was asking back there, can this just be used for tightness and make muscle relax and elongate?
Yes. Yes. So it isn't intended as much for post exercise. Actually, some of these nice devices here are for post exercise. This is actually intended for pre exercise
Okay.
to enhance blood flow prior to the activity that you do. But it also can work well for people, like I said, who've maybe had a period of immobilization where that knee is just tight and stiff. They've had surgery, or they just feel like for whatever reason that quad is really tight right now. This will help improve the flexibility of that muscle.
So I'm assuming you do this and see how it goes over the next 24 hours before you would do another
Yes.
treatment.
So usually when you first start out, you want to wait about 24 to 48 hours
Okay.
before you do it again. If there is any bruising, then it's about 48 to 72 hours before
Sure.
you would do it again.
And once you did it and you had some good success, I mean, once a day would be enough until the symptoms are
Once a day,
gone.
or actually as the symptoms start subsiding, then you start decreasing the frequency that
Okay,
you do it. Probably
sure.
once every 3 to 4 days is all you would need to do it, to eventually where you would only do it as you start feeling symptoms.
just kind of a maintenance
Yep, as
as
needed.
needed. Yep.
So
Good.
notice that you can feel there's probably an increased tissue temperature in
Yeah,
there.
absolutely. Yeah.
And that again is a good sign.
Yeah. So what do you want to mention your clinic, Paul?
Sure, it's a pretty small clinic. So it's called Specialized Physical Therapy of La Crosse. I work out of the Bell Square Clinic in La Crosse, Wisconsin, and I only see patients for about 4 to 5 hours a week. That's really it, because my primary job is at UW La Crosse in the physical therapy
Yeah.
program.
Yeah.
But you can certainly look me up on Facebook, and on Facebook you can see how you can schedule appointments
Sure.
on there.
You may have people coming from all over the
Well,
world,
I
Paul.
hope so. You
No,
know?
actually, Paul he's a good therapist, and I think you treat people to educate them how to treat
Absolutely.
themselves at
Yes.
home, so when they go, they have an idea of how to keep care of
Yeah.
themselves.
Yeah. My
Right.
main intent, if you were to see me as a patient, is really to educate you on how you can manage these symptoms on your own and become self-reliant.
Sure.
And this is a great example of how
Yeah, it
that's done.
is.
Yep.
So it looks like we could probably do this in other parts of the body.
Absolutely. You can do this really anywhere that you can access with your hands.
Right.
So, elbow pain works really well with this. Again, the general rule of thumb is always move away from the bone. So, here's the bone. You don't want to go towards it because that's just not fun to bring a tool or instrument
Yeah.
over that. So, always away and always think of
Shovel,
shoveling, not raking.
not raking.
Yeah.
Winter time, not fall.
So, the other thing you have to be worried about is if there's any open wounds or anything like that, or if there are sutures
yeah.
or scars that haven't fully healed, never do that over any sort of open wounds or scars.
Yeah.
But as long as skin is intact, you're safe. Okay.
Cool.
Yeah.
Oh, all right. Well, thank you so much, Paul.
You're
This
welcome.
Is
Thank
a
you
really
for-
wonderful addition to our repertoire.
Yes.
We're excited you could come.
Okay.
So very good. Take care and be careful. Anything you want to say, Paul?
No.
No.
Good.